Hi, I'm Amanda, and I'm an athletic training student here at Seton Hall University, and today I'm going to be the clinician.
Hi, I'm Jess. I'm also an athletic training student here at Seton Hall, and I'm going to be playing the patient today.
So today we're going to be focusing on hip extension exercises. So for each exercise, we're going to start out with a lower amount of reps or seconds that the patient's going to be holding it for, and then depending upon the patient's pain or status or execution of the exercise, we can progress them to a higher amount of reps or a higher amount of seconds that they're going to be holding it for, or we can regress them if need be. So the hip is a ball and socket joint, so it allows for hip flexion, hip extension, which is what we're going to be focusing on today, hip ab and adduction, and hip internal and external rotation. So the most important muscles involved in hip extension are going to be the hamstrings and the glutes. So the first exercise that we're going to be doing is an isometric hip extension exercise. So the patient is going to begin starting with their back to the wall, about a step away from the wall. So if they're going to be doing right hip extension, they're going to stand on their left leg, and they're going to drive their right heel into the wall, extending their hip. They're going to hold this for 10 seconds, and they're going to be doing this for 3 reps. If you want to progress the patient and make this a little more difficult, you can have them step further away from the wall, and this is going to activate your hip extensor muscles at different angles. This also demonstrates some proprioception. So the next exercise is going to be an isotonic closed kinetic chain exercise for hip extension. So I'm going to have the patient do is I'm going to have them lay on their back in a supine position, making sure that they keep their back flat on the ground, their hands on the ground, and their feet are going to be on the ground about shoulder width apart. So when we begin the exercise, the patient is going to lift their hips up and then back down again. When they lift their hips up, they're going to be making sure that they tuck their belly button in, squeezing their glutes, and driving their hips up. When they're up in this position, you want to make sure that their shoulders, their hips, and their knees are in about a straight line. So these are known as glute bridges. The patient is going to be doing 3 sets of 12 reps. So as far as the concentric and eccentric phases go, the concentric phase is going to be when they're contracting their muscles, bringing their hips up, and then the eccentric is going to be when they're bringing their hips back down. If we want to progress the patient, we can progress them to doing glute bridges on single leg. So the next exercise is going to be an open kinetic chain exercise for hip extension. So I'm going to have the patient do is I'm going to have them get into all fours, a quadruped position. And we're going to be doing an exercise known as scorpions. So I'm going to have her squeeze her core tight, sucking her belly button in, maintaining a flat back, and I'm going to have her squeeze her glutes and lift one leg up. So she's going to lift it up and then back down again, and she's going to do this 10 times, 3 sets. So this is activating her right hip for right hip extension. So if you want to, you can switch and do left hip extension as well. So our last exercise is going to be a functional exercise for hip extension. So if my patient is a basketball player, I'm going to be having them do a lefty layup for right hip extension. So I'm going to have the patient start in a lunge with their left knee up and their right knee down, already starting with their right hip in extension. Then they're going to explode off their right foot, doing a lefty layup, lifting their left knee up, and they're extending their right hip. The patient is going to be doing this for 3 sets of 10 reps. Thanks for watching. See you next time.